highlight 3 concepts that have to do with DOMS, delayed onset muscle soreness, and soreness as a symptom felt in a muscle. And people will use other words other than soreness, maybe tightness, discomfort, achiness, but I think we can appreciate for this discussion that soreness means all of those different things. And why this concept or these concepts are important is because I don't want people confusing true symptoms for, oh, I'm just sore from working out, or I'm sore from a new activity or moving apartments, etc. So there's ways to differentiate them. I think there's 3 main ways in my book. 1, delayed onset muscle soreness is delayed onset. It can be anywhere from 12 to 48 hours. Me personally, I'm not having soreness set in for close to 24 hours at the earliest, and people have individual differences. But if you're presenting with soreness, maybe symptoms in your muscles before 12 hours, especially if it's within an hour or 2, well, then that's not delayed onset muscle soreness. Until proven otherwise, to me, that's soreness felt in a muscle because a joint got tweaked, possibly what we would call a mechanical joint derangement if we can fix it with 1 or 2 specific movements. But joints do refer symptoms to where muscles are. And I think it would be more concise to say joints refer symptoms to muscles, but I don't know if that's the case. I think joints refer symptoms to a body part, and where that body part is, in the buttocks, in the thigh, in the shoulder blade area, there are muscles there. And so people confuse the 2 concepts between the muscle being the problem or the symptom being felt where the muscle is. So the timing is an important piece of the puzzle. Of course, if the symptoms last for 5 days or 6 days, then that's also a clue it's a symptom and not just delayed onset muscle soreness. Number 2, if you have been working out your body equally, bilaterally left to right, you're doing walking lunges, you're doing a squat, you're doing rows, equal left to right, and you're only sore on one side, only your right glute, only your left hamstring, only the posterior deltoid area on your left shoulder, then you have to start to consider, is this a symptom? Because if you're working out your body equally left to right, if you're going to have soreness from the activity, it should be equal left to right. I think people here kind of get into these long-winded stories about how they're weaker on one side and therefore they're sore on that side, or they are dominant on their right hand, therefore their left side is more sore. Yes, that may be true, but I think you're really reaching there, and you need to consider that this is a symptom, not just normal soreness from new activity. And thirdly, if you're going to be sore from a new activity, a greater activity, a new load on a muscle, you should be sore where that muscle is. And I think this shows up mostly when we talk about the spine. The muscles along your spine primarily act as spine extensors. So they extend your spine. It could be taking the spine from flexion to neutral, from neutral to extension. Anytime you're moving into extension and asking your muscles to do that job. Or of course, if you're holding your spine isometrically against gravity, that also taxes those muscles. But I think a lot of people will be sore in their spines and say it's because the muscles in their spine have delayed onset muscle soreness, when in fact, if they really thought about the exercise or the activity that they were doing, they weren't really loading those muscles. Instead, they were loading the muscles in their extremities, for example. So if we think about those 3 pieces of the puzzle and we take some other pieces of the puzzle into account, we should be able to differentiate with certainty whether or not what you feel in your right glute or your left calf or your neck, if it's truly delayed onset muscle soreness or if it's actually a symptom. And again, people may call it soreness or tightness or discomfort. People don't typically call it pain, but they know that if anyone's worked out really hard, you know that it can approach pain. It can be disabling for a day or 2 if your DOMS is so severe, making it hard to move, because when you move that muscle, it's very uncomfortable, borderline pain. For me personally, when my low back is deranged, when my low back joints are tweaked, I will present with right greater than left or bilaterally equally symmetrical right and left buttock pain. And I can tell you from experience, it feels like the day before I did 100 squats. It feels like I just worked out my glutes extremely hard, although of course, in those cases, I did not. So if you feel like you worked out and your muscles are that sore, but you didn't, you have to know that this is something going on. And the bigger picture, why this is important, is because you don't want to miss a symptom if it's telling you something's wrong, especially when it's kind of more benign of a symptom, whereas maybe you have pain just for a day or 2 or a week and you haven't really lost a lot of mobility, you haven't produced nerve tension. It's not quite that severe, but you get that buttock pain or you get that bicep area pain. So if it's a symptom, it's important to note, because then you know that you have a problem and you can go about trying to reverse it, of course. So think about these 3 parameters. We just don't want people confusing normal physiological DOMS when you put a new activity through a muscle that it hasn't had before, or the same activity with a new load, versus a symptom, because we want to be able to identify symptoms and address them.